Former Chief Medical Officer and Chair of the Health and Best Practices for Recover Saint Lucia, Dr. Stephen King, is recommending a new way to tackle COVID-19. The non-compliance of individuals has forced the government of Saint Lucia to announce the rollout of COVID-19 wardens. However, Dr. King says this may not be the best approach. He instead advocates a national behavioral modification campaign.
The approach that we are adopting is one of cooperation. So in other words, let's just create the social pressures rather than a law enforcement approach, because we believe in motivating. So for instance, the COVID wardens are really protocol champions. It's not the power of arrest that works, it's the power of persuasion, information, education, motivation, communication.
Another priority area identified by Dr. King is enhancing health security, particularly the current protocols for entry into the island. He suggests the authorities consider adopting the best practices of other territories that have proven effective.
When we look at entrance to the country, what is the best protocol? We look at examples like Barbados. Is that a good protocol? Should we be looking at it? Should we be adapting it? And these are the kinds of conversations that we want to have in our committee and share with the national team.
The final key area outlined by Dr. King is that of contact tracing. The former CMO differs with some medical professionals on withholding pertinent patient information that may help in widening the net in the contact tracing effort.
Not knowing can hurt. If you don't know somebody's infected, if you don't know you're infected, that's a problem. So we want to enhance and deepen and widen contact tracing, and in particular, support people who are identified as contacts. There's psychological support, there's health support, the health screening that needs to happen, the testing that needs to happen. And we believe that we can actually help by mobilizing across the country through businesses, through communities, to help the ministry with contact tracing. The other issue is there technology that we can bring to bear, contact tracing apps, electronic apps that we can bring to bear.
Dr. King is lobbying for a public health approach model based on identifying and analyzing the problem, adopting best practices, married with resources, to devise a plan of action that, upon implementation, retains the flexibility to evolve when needed. Solange Alfred, HTS News Force.